introduce again, so that when students are actually chatting on that platform, the administrator, officer, the parents, the teacher, and the student can actually monitor the activities. And if you are interested actually to know more or to see more about the software, I can actually drop the link before I leave. And also, if you're actually interested in this idea and you want to actually empower me, you can actually do, and I will really appreciate it. On behalf of Tech Solution, I want to say a big thank to you for giving me the opportunity to come and preach this today. Thank you and God bless you.
All right, thank you very much for that. On to the next person. Shedrack, Commission.
Good evening, everyone. My name is Shedrack. I'm a student of the Department of Mathematical Sciences. So, in studying how our cultural heritage interact with science advancement, interact with how advancement is made in technologies, made in agriculture, and made in entrepreneurship, we do see different things play out. And then what I've done is to model the dynamics of this interaction and give us two things. Number one, it gives us an idea of what will happen whenever our innovation, whenever our idea interacts with cultural heritage. And number two, it gives us the power to change things. So what do I mean by cultural heritage to start with? Now, Nigerian cultural heritage refers to the cultural, social, and historical practices and values that have been passed down from generation to generation. We have historical history, heritage, which is part of our pre-colonial and colonial era. We have our social heritage, which is the family structure, which is uncommon in any other society we get to in the world. We are the society that practices extended family structure, and this is unique to us. So we pass this on from generation to generation. We get our children to know their uncles, their nephews, their cousins, and this is evident in everything we do. But whenever we are coming with new ideas, when it has to counter with cultural heritage, sometimes it affects it, and cultural heritage influence practices in medicine, science, and technology. If the slide is on, I will have shown you the second slide I have here. So despite the fact that we all know that health is wealth, the answer is that there are new drugs that are coming out every day to enhance our well-being. The cultural heritage of we having the mentality, okay, there is this Nigerian heritage that I want to really emphasize on, and which is the belief that our independence in what we have before the Western modern ideas coming. Everything we have a way of doing, we have already been doing it before the Western came, and then if we are going to have advancement in technology, we are going to also be considering the fact that we have cultural heritage to consider as well. So despite the fact that there are advancements in medicine, you still see people that buy agbo, despite the fact that there are doctors that are advising against it. That is not that agbo is not good, but it's just that you don't have the measure of it, and when you don't have prescription, it's not good to take. But in medicine area, we have the cultural practice of agbo, of self-medication, interfering with advancement in drug. In this kind of situation, we can say that the both are coexisting, but it seems as if to some population, the local heritage is taking over the new advancements in technology. But when we look at chicken rearing, for example, we used to have a way we rear chickens in those days, which is extensive agriculture. We just send out chickens, they eat, and then when it comes to want to eat them, we pick them up. But when we look at everyone in Nigeria today, we practice the modern way. The idea is now flourishing. We buy boilers, we buy drinkers for them, to the extent that we will take vaccines for them. In that sector, modern idea is thriving. So what do we get? I have written a model that will first of all tell us if there is interference between a modern idea and the cultural heritage. Which one will survive? Will the modern idea survive, or will it be displaced, or will they both coexist? And secondly, we have written such that we are able to change the parameters in our population, and we can change our fate in case we want to innovate, and then maybe the modeling is telling us that we will not survive. What do we have to change our fate? So this is important because no matter the idea we are coming up with, no matter the idea innovation we are coming up with, we need to understand how this will work, how it will play out, even before we go into it. A lot of advancements in technology have been underutilized. There was a time some years ago I got to know about a chemical that you pour into water, and then you stir it up. By the time you stir it up, even the littlest microorganism will settle down, and then you can see it and get your clean water. But despite the tremendous greatness of this idea, this innovation is underutilized and it's almost gone as a waste. So I use the SIR model, which is used for modeling diseases, but I modified it to my situation. So in doing that, I classified my population. Let's say the population is the whole country. I classified them into 4 compartments. We have the susceptible compartment. These are people that are vulnerable to. These are people that are still using traditional methods in whatsoever way we are talking about, but they are vulnerable to adopting this new idea, probably because they are being advertised to them over time, probably because they need people that can tell them about the new idea, probably because they get to get to see how this new idea has been put into place. We have the infected, the second compartment. The infected are people that are already adopting this new idea. This is what we want, especially as scientists and Nigerian scientists. We want the infected people to be the highest. We have the recovered people. Now, the recovered people are people that are adopting the modern idea but still retain their cultural method. They are like a blend of the both, because we are a country that is conservative. We want to innovate, we want to advance, but at the same time, we don't want to forget our heritage. This may be what we want to be. And then the last one are the traditional retention compartment. These are people that however the idea is put to them, they will never accept it, probably because of their belief, probably because of many factors, probably because of social, economic factor, even probably because they can't afford it, probably because of their religious belief. So I have 3 parameters. Parameter delta is the rate of infection, the rate at which people that are susceptible, that are vulnerable to accepting this new idea are now accepting it. You can call it the probability that anyone that is vulnerable to accepting this idea will accept it. If you use arithmetic theory of probability, which is just to the normal simple probability. When you want to select, when you want to get the probability of a boy being choosing, a male being choosing in this configuration, we have to like divide the number of boys by the number of total people seated here. So this will be the total number of people that are using, total number of people that are vulnerable, total number of people that are infected over the total number of people that are susceptible. And we have the recovery rate. This is the rate that an individual who has accepted the new idea will still retain the traditional idea. And then you have the traditional retention rate, which is the probability that a person continues to use the traditional method exclusively. That person will never accept the new idea, no matter what. So each of these parameters takes the value from 0 to 1. Probability that they will be, if it is 1, then the whole population that are susceptible are accepting this idea. And if it is 0, then nobody is accepting the idea in case of infection and corresponding to the rest. So I move on to ODE, which is my ordinary differential equation to model the parameter. The rate of change of susceptible, people that are susceptible, the rate at which the interaction between a susceptible person, the person that is unable to accepting this new idea, and the person that's already accepted the new idea, that's SI. So the rate subtract from when this person accepts this new idea, it subtracts from the people that are already, it moves them to the infected, and then also the people that after is my retention, people that are already used not to accept the new idea also. So this is, if you add up everything together, you get 0. And this is a model for it. So what do I have here? S susceptible can either move in the direction of retention or can move in the direction of traditional retention. So next slide, please. So let me round up everything. So next slide, please. Western country and Asian country. So by the time you walk around this, you get an idea of what we are trying to say. We are not going to be solving it because it's not solvable, but we are going to like walk around this and get some idea. So in a country like US, where adoption rate is high, where people don't really recover from this idea, they don't get to retain traditional idea, they move on to the next hot thing, and they have low retention rate. What will happen is that modern ideas are quickly adopted and traditional methods are displaced, they are not retained, and new ideas quickly wear out. For example, if there's this newest idea today, then by the time a new one comes out tomorrow, people will leave that and go on. But in a country that's conservative like China, where there is models, where there is characteristics, where it is a country that Nigeria should model after, because we are also a conservative country. So what does this tell us? This tells us that whenever the best thing for anybody that is building up idea in Nigeria, being a conservative country, is that in the second point, a new idea should be built on traditional practices. So what is our project? What goals we want to achieve? Probably minimize the tension. So we offer consultancy to Nigerian scientists, to Nigerian inventors, to Nigerian farmers, and to Nigerian industrialists, that whenever they want to work, anything they are working on, they can consult us at the Department of Mathematical Science, and then we can help them. It's not enough to just have an idea. We have to know how to be modeled out eventually.
All right, thank you very much. On to the next person, Mubarak.
Okay, good afternoon, everybody. So, I'll try to make it as simple as possible because it is hard to follow because it's a bit abstract. So, I'll try to make it as simple as possible. So, speaking about culture, what happens to our culture when fire destroys everything? That's the problem we face with gas 264 gas explosions in Nigeria. Half of that amount were gas explosions. Property destroyed, life taken. In 2022, there were over 2,054 gas explosions recorded. Costing in Nigeria was 1 trillion naira lost, worth of property lost. So you see, in Abuja, there's a recent gas explosion, like not too recent, but recent. A person died, individuals were fatally injured. Gas explosion again. Yeah, not too recent, but recent. Explosion in the hostel, people injured. Gas explosion again. What do we do? Do we sit down idle and watch this gas explosion of people draining properties and killing people? No, my team and I sat down and deliberated carefully. What is the solution we could prefer that will be scalable? Our solution will be marketable, our solution will be sustainable, and our solution will be most important, addressing the issue of gas explosion. Then voila, we came up with gasoline. Gasoline is the name of our detector. So, talking about our detector now, this way becomes complex because you can't see anything. But for most people that know hardware as well, they'll be able to follow. But regardless, I'll make it as simple as possible. So, our device is an iris embedded device. It's going to be able to receive messages. It's going to be able to send messages via WhatsApp, SMS, and even make false calls when there's a gas leakage. So our device it has a sensor, MQ6 sensor. What that sensor does is that it measures, because you are very clear that gas explosions are a result of too much concentrated gas in the atmosphere. When everywhere is filled up with gas, concentrated, any spark. So we want to stop this gas explosion before it happens. When there's too much gas in the atmosphere, the sensor detects it, and the microprocessor takes it and goes to the SIM module. The SIM module is where you that are using the gas, your SIM is there. The SIM, there's a slot for the SIM in the gas detector when the detector is able to send messages to you online. So not everybody has the leverage of checking their WhatsApp every day, or not everybody has data every time. To show that this is important, we now created offline method like SMS. Okay, not everybody checks their SMS daily. Like I don't remember when last I checked my SMS. So that's that. So realizing that part, we now created one for false calls. Because there's no way your gas detector will call you once, twice, thrice, and you don't want to see what's happening. So it will send SMS notification offline, it will send WhatsApp notification, and it will force call you to tell you that gas is leaking, do something about it. The truth is our gas detector will not be able to do anything about it. But we are still working on, like, if there's a way it can mitigate or reduce the effect of this gas before it explodes. But for now, it won't be able to alert you. So it has a buzzer that will alert the people around that this is what's happening. There's a gas, the buzzer is going to be very loud that people around the neighbors and people are going to be able to hear that things are happening and stuff. The gas detector is going to have a mobile app and tell you how much of gas is remaining in your cylinder and all of that. So moving on to the next slide, that now brings us to, I think I can even skip the next slide because what is telling you how far we've come. We've developed certain prototypes. We've made significant prototypes. We've made a prototype that we've tested and it has issues, but it is still working as we want it to. We believe that within the time frame of like 3 to 4 months or so, we should be able to get our stuff in the market. So that brings us to the cost. R&D, yes, that's it. Research and development, we're going to be thinking about 150K for it because research and development into this kind of product is going to be cost. And hardware, we're buying more, that's 70K. And software, we need people, other teams, other people in our team too, for the software for, so that will be around 30K, into an estimate of 250K. In conclusion, that situation is very, 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 it's a very drastic effect. The effect it leaves behind for is drastic. It aids climate change, it aids global warming and all of that. It is very, very disastrous. My team and I are working towards making Nigeria more green and more safer for all of us.
All right, thank you very much. On to the next person. Stephen,
Please, 3 minutes. 3 minutes. Good afternoon, ladies and gentlemen. Thank you so much, SCIENCOON, for this opportunity. I'm still in the brand owner of Timeless International. I would like to lead this speech with hands up. Okay, I'm not seeing much hands up. All right. The second question: if you are the kind of person that prefers your enjoyment regardless of your health, can I see hands up? Okay, one question. All right. So it means that most of us actually prefers or prioritizes our health over enjoyment. Timeless beverage is a beverage brand that is poised to change the face of the beverage industry in Nigeria through drinks that are both healthy, indigenous, and refreshing. We are inspired to solve the multiple health problems caused by conventional soft drinks. And you may want to ask, why are we doing this? I tell you a story. I was just 15. My pastor was terribly sick. In fact, we thought he was going to die. Getting to the hospital just to discover the cause of this problem. And my pastor so much loved something, and this was the problem, right? Is it his fault? Maybe not. Soft drinks are so refreshing. Imagine coming back from Putason. You want to take something refreshing, right? Yeah. So the solution we are bringing forward to the table is that what if people could actually get refreshed and at the same time get vitality, and then they are not taking away from their health, rather the soft drink is adding to their health. So this was what created Timeless. So our mission is to raise the next generation of Nigerians with better health. And why do we do this? Let's look at according to WHO data 2014, 422 million people globally live with diabetes. In 2021 alone, 1 in 10 adults suffer from diabetes. It means that, I think we're about 100 here. It means it's 10% is prone to diabetes. Nigeria is among the top consumers of soft drinks. In fact, Nigeria ranks 7th in the global consumption of soft drinks all over the world. So, a bottle of a conventional soft drink, for example, contains as much as 59 grams of sugar. So we can see that this is a real problem, right? So is there something that we could do? Albert Einstein said, and I quote, we can't solve a problem with the same thinking that created it. So we decided that Timeless will be made differently with an ingredient that is unique to us, which is the hibiscus. So the innovation that we brought into this is that the normal hibiscus can last only a maximum of 2 days. And we are looking at a solution that should be scalable. This solution is not scalable. But with our innovation, our hibiscus drink can last 2,900% higher, which amounts to about 50 days, which makes it commercializable, saleable, and profitable because we cannot produce on a large scale. So we present a drink that is both nutritious, indigenous, refreshing, and healthy. So if you are the kind of person that prefers your health over enjoyment, which most of us do, Timeless might be your best bet. So I'll round up in the next 1 minute. What have we done so far? We've been having a series of challenges. One of the major challenges is the NAFDAC registration. We've set out on this process, but it demands quite a number of time and also a huge amount of capital. So we are looking at securing it so that we can certify our brand. Recently, we got an investment of 100,000 by someone that got impressed with our brand. We are looking at getting more investment so that we can scale our solution. We are a team of 6, and we are working hard so that we can solve this problem, and then we can raise the new generation of Nigerians with better health, and of course, they can also have their refreshment. So, thank you very much. Both Timeless, both Africa, both healthy refreshment. Thank you, sir.
All right. Thank you very much to everyone who pitched. Thank you very much. All right, a round of applause for them, please. If you enjoyed that,
A round of applause. Thank you so much for that. I think the Growth Hub will still say something about that later. So right about now, we want to welcome, there's a phone line actually vibrating. You got the owner's name with your receipt and the NAFDAC number. Thank you. All right, so welcoming the Pioneer Medical Initiative now for their presentation. I know you'll be enjoying it very well, and it's going to be great indeed. You know, they are setting up already. So please and please just stay tuned and no, don't touch the dial. Let's sit back and enjoy that session. God bless you.
Good afternoon, everybody. I trust you're enjoying yourself and being impacted too. So, without further ado or what I do, we are going to LD series now. And LD series is a symposium that is being held by Pioneer Medical Initiative. This is LD series 2.0, the second version. And we've had one some years back, right? And this one is a LD series, is a symposium that is held in student community, like FUTA here. So now, before we move forward, I would like us to know what PMI is. That's Pioneer Medical Initiative. What it's all about, what we do at Pioneer Medical Initiative. So, ride along with me. All right. So, Pioneer Medical Initiative. Okay. About us, Pioneer Medical Initiative is a non-profit and youth-driven health organization focused on promoting healthcare inclusion, accessibility, and affordability to achieve SDG 3 and Universal Health Agenda and coverage agenda. So what we do, we are majorly we're into advocating for health equity. And in Pioneer Medical Initiative, we are focused, like I said, we are focused on non-profit and youth-driven health organization, which is focused on promoting healthcare inclusion, accessibility, and affordability towards the quick achievement of the United Nations Sustainable Development Goals and Universal Health Coverage Agenda. We journey towards the goals through healthcare advocacy, activism, innovation, research, and technology. We believe that the right to healthcare is just as important as the right to life, and as a threat to life. And we believe that the right to healthcare is just as important as the right to life, and that a threat to this right is a direct threat to life, and as such requires effective intervention. What's our vision? Our vision. Please, next slide. Our vision is to build an Africa where there is inclusive, affordable, and accessible health care for every individual with equitable distribution of primary health care. Then our mission is to improve the health of low-income earners in rural communities and marginalized groups in Africa. Next slide, please. So in Pioneer Medical Initiative, we have about 6 networks in 5 different states. We're not only in FUTA here, we're in FUTA, we are in FUNAB, we have FUNAB network, we have Ile-Ife network, we have Shagamu network, we have LAUTECH network, and we also have Lagos network. The next slide, please. And so what are the So what are the activities we do at PMI? We have a lot of activities that we carry out at PMI. Number one is the annual boot camp. What's the annual boot camp all about? In the annual boot camp, what we do there is, as Pioneer Medical Initiative, we train curators in our annual boot camps through our annual capacity building and networking program for youth, for young health volunteers and experts working to improve access to healthcare in underserved communities. So here in this boot camp, what we do is we train curators, we train volunteers, those that are interested in healthcare, those that are interested in health. So we train them, and there are and then they get the access to network with healthcare professionals too. And then we have Health for Rural. Here in Health for Rural, Pioneer Medical Initiative Health for Rural project is focused on the provision of primary health care services and establishment of resident healthcare facilities in rural communities. Next slide, please. Then one of our activities is document the undocumented. Here, in document the undocumented, document the undocumented is a spin-off of the advocacy arm of Pioneer Medical Initiative towards the provision of a sustainable, qualitative, and equitable healthcare system in Nigeria. The ultimate goal of this project is to promote the incorporation of the accurate health data of the members of unreached rural communities in Nigeria healthcare system and database. In document the undocumented, here we get data to places that we get enough data to places that have not been reached, and then we administer health care services to those places also. And then one of our activities is Project Air Up. Project Air Up is currently ongoing, and Project Air Up is focused on providing access to medical oxygen in rural and pen-urban areas in Nigeria, or pen-urban communities in Nigeria. This is a strategic partnership between Pioneer Medical Initiative and Health Port Africa. We are in partnership with Health Port Africa to provide medical oxygen to rural areas, to rural communities that don't have access to medical oxygen. And then we also, some of our activities is genotype and blood typing for rural communities. Yeah, in this project seeks to lead widespread screening and awareness of genotypes among women and men of childbearing age in rural communities in order to stop the sickle cell disease. Here what we're interested in is we make sure we screen people to know their genotype and also their blood type, so as to make people or young men and young women of childbearing age aware of their genotype, so as to stop the sickle cell disease. I hope you understand what I'm saying. So next up, what we do at Pioneer. Next slide, please. Like I said before, our network, I've listed that. Next slide, please. So here in Twitter Network, what do we involve in? We are involved in weekly trainings. Now, weekly trainings, that's where we train our curators on how to. Some of our curators are not medical students, but then we train them on how to take some vital or basic medical services like your pressure and all of that. And then we also, next slide please. We also do medical outreaches, communities, for rural areas, for churches, for societies, or whatever organization you have. We're always very much available to take out your medical outreaches. Next slide please. Then health awareness. Here, health awareness, it's a form of advocating for health awareness in community, in anywhere we find ourselves. And we also partner with other organizations like Red Cross, and even in our school here, we partner with BAMSA and other organizations like that. Next slide. So, what have we done in the past 5 years? In the past 5 years, we have remained relentless in impacting. We have remained relentless in impacting rural and underserved communities, specifically with the commitment of our curators, of over 350 curators. Through the help of over 350 youth curators across the nation, we have reached 5,000 plus individuals. We have screened 5,000 plus individuals, and we have also cared for 10,000 plus low-income earners, and 25 plus communities have been reached. That's what we have done so far, and we are still doing more in Pioneer Medical Initiative. Next one. So these are our major team here at Twitter. Here is our lead curator, Pomine of Ogujemete. She is the founder of Pioneer Medical Initiative. We also have our director here at FUTA, that's the person of Daramola Damilare. Next slide, please. Thank you so much for listening. And we are going to the next session now, which is our panel discussion. And we have with us here our panelists. Please show us. So we're going to our panel session now. And Daramola Damilare will be anchoring this session. Thank you so much.
Good afternoon for your time. Thank you for staying till this very moment. So our panel session now is going to be brief and quick. So we'll be talking about healthcare and national development. So I am not here alone, right? With me I have those who are so vast in the field of healthcare, those who are experienced, those who are professionals in the field of healthcare. So I'll be inviting to the stage with me. I'll be inviting to the stage with me a distinguished physiologist, someone that is specialized in exploring the impact of diet on metabolism. Right, he's an outstanding associate professor here in FUTA. Right, he has several awards. He has in his portfolio. He's a global leader. Right, he's someone that is so vast in the field of research. And with us here is Dr. Adedeji. I think we do better than that. You're welcome. Also because he is the assistant chief nursing officer. So the chief officer of this chief office, the chief nursing officer is duly represented by the assistant chief nursing officer, the person of she's a public health nurse, right? So she's the assistant chief nursing officer of University Health Center. So join me to welcome Mrs. Bolade Ola. You're welcome. Thank you for your time. Alright, so like I said, it will be as brief as possible. And we want to let each and every one of us know the impact of healthcare when it comes to national development. Of course, in a nation like Nigeria, right, one thing that is so rampant when it comes to the country healthcare system is malaria is very rampant. In fact, once you go to the health center and what's the first thing the doctor will tell you that is wrong with you? Malaria. That's it. That's what most of us always experience. Because in this part of the world, malaria is something that is so rampant. So how does national development comes in when it comes to, how does healthcare comes in the area of national development? So in the next few minutes, we'll be engaging ourselves on this very thing. So my first question goes to Dr. Adedeji. So I want to ask you, can you share with us, of course, in Nigeria, we know that there are several challenges. In fact, according to the World Health Organization, there is a 2 to 1,000 ratio, like 2 professionals to 1,000 patients in the Nigerian system, right? Why? Because we are really suffering a lot when it comes to healthcare. The budget is for healthcare really, really low. So what do you think can be improved? What are the necessary improvements needed? You think, or you know that, of course, we need improvement here. We need improvement here for us to achieve the best healthcare. Thank you, sir.
Thank you very much. So one of the things that I think is very essential that we have to focus on is that, if we're going to get good health for, in Nigeria generally, the main source of the health professionals, or in fact the system itself, is dependent on what the input is. So one of the first things that we have to focus on is how exactly are the health training institutions faring? Because, year in, year out, we're seeing that the standards in many of the health training institutions are actually falling. So, that's the most critical aspect of it. How is it that we are turning in garbage and then we expect that we're going to have something perfect come out at the end of the day? So, first problem I was able to, itemize was that we have a problem with even the teaching structures that we have in Nigeria. I remember when I was here, I listened to a couple of people who were panelists, and one consistent thing that I saw was that we keep importing systems that we can maintain. We're not trying in any way to localize any of the things that we're doing. And unfortunately, Nigeria is not good in management, which means that if we keep having to import systems in all the time, expensive systems, can we manage them? Are we trying to look at home-based solutions to some of this, even teaching things? One of the things I've seen practically in the field is that if you are able to use things like outreaches, we don't teach. I've seen that students or residents are now beginning to train themselves in outreaches. This is one of the things that PMI is doing. So simple things like educating the populace can go a long way, totally changing, the health status of the community. These are simple things that we can do. Nutritional training. Are we actually training our doctors? I train doctors. Do we train doctors in the curriculum we have right now in how to guide our patients in terms of nutrition? Do we train doctors in, things like patient-oriented care? When you're talking to the patient, are you hinting the patient that don't take antibiotics anyhow? I was talking to a couple of people 2 days back, and what they were, what is it that they said was wrong? Well, she said that she never gets better if she uses anti-malarials for malaria. That she has to add antibiotics to it. For someone like me who understands medication, what it means is that if you're at this point already using the heavy antibiotics, what happens when you eventually come up with tuberculosis? Then the chances are very high that you are going to have antimicrobial resistance and probably die. So these are the kind of things that we can simply start inculcating into the curriculum, rather than focusing on, important technologies all the time. There are other things that I've also said. Well, I know definitely eventually we're going to have to talk about funding. One major problem we have in the health sector and even in education is funding. There's totally no funding for any of this thing. The Nigerian government is going to spend a lot of money on a lot of things, and the budget is going to be less than 5% for both education and health. Now, what that means is the WHO standard is minimum of around 15%. Yes, nobody in the world needs it. But I'll give you an example. In the United States, 12% of their budget will go into either science to help healthcare or even actual healthcare. I work at the NIH, and I know that as of 2 years ago, the budget was $450 billion minus other things. Now, you can now understand why healthcare systems there will work, the one we here will not work. And, I've heard a lot of arguments on all counts. One thing I'll say, just to round up, is that whether we like it or not, the government is the main source for health and education in any community that's going to work. Thank you.
Very much. Now, insightful. We really need the government to make things really work in this when it comes to the healthcare sector. Alright, so my question goes to our professional nurse. Of course, we know this Chamba syndrome, right? Right. It's something that is rampant today. In fact, people are ready to sell their property because they just want to live. Right. So then you are in this system, but then you are still a 10 years person in education. I want to leave the country. And then she has been trained, but she just wants to live. How can we retain these professionals that are complement for a better healthcare system? Thank you.
Well, thank you very much for this opportunity to be here this afternoon. Like the question you asked, Dr. Lily said something about the system that we are operating here in Nigeria. In the last 10 years, if you should look into the health sector, there was no this this migration of health personnel into Western world. People do travel, but it's not as in the recent, because of the economy, because of the working condition, because of the low remuneration for health practitioners. So, like what you said, we don't have a working policy, no formulation on health. Like you said, there was something the other time. It is the responsibility of the government to fund education and health. A healthy nation is a wealthy nation. For you to be productive, if your health is underestimated, if your health is not well managed, there could be problems. When I sat down, they are talking about cultural, the issue of culture in all things that we are doing. There's what we call culturally competent services. If this has been incorporated into our curriculum, into our practice, this issue of people living wouldn't have been. I used to tell myself, our leaders do travel over there. They see what operates. Can't we bring those things in? No? There should be a collaboration between the academia and the people that are in the clinical area. We merge our experiences together, be able to come up with good formulation, how to move our hospitals forward, how to move our health sector forward. So I think one of the reasons is bad policy, government policy. To get it right, there should be a good policy. Because over there in the Western world, they see healthcare industry as a sort of internally generated revenue. Because there is no way, and that is why they subscribe to this NHI of a thing. Because health over there is expensive. The government made it in such a way that it's affordable, it is accessible to the people. So the same thing, our government should get it right. Thank you very much.
Thank you. Our government should get it right. So when they go there, those things can be replicated here, of course, really. So the next question I have for Dr. Atekiki is, like the academia, right? What's going on in the professional field, this chapter is about. What strategies can you, we're training the students to become a professional, but then what they are going to face. How can you prepare them, this is what you are going to face, but then you are going to face this is what you have to do, so that they get to prepare their mind, we know what's going on, and we are going to face this, but then we still have to make the healthcare system of this nation work out in the university system in 2 minutes. Sorry, 1 minute, can you share?
Thank you very much. I need to re-emphasize what Madam said. Science policy is a major problem in Nigeria, and health policy, of course, follows suit. You see, if you do not have the people who are the experts in the field determine the policy, eventually you are going to have a problem again in the training of those experts. So that's why we keep having a cycle, and then we'll have a problem with it. So in terms of having people leave all the time and trying to prepare students, the frank truth is that the society already prepares students in one way or the other. It's just that it prepares them in the wrong way. It conditions them mentally in the wrong way. But then one of the things that I consistently try to drive on that, I think I mentioned already that we should start exposing our young people to other solutions. So in Nigeria we have this, we do not have enough doctors, we do not have enough nurses, we know this. We do not have enough pharmacists. But one thing that is very clearly missing is that we have capacity for a lot of medical research that we do not utilize at all. So these are the kind of places that we try to push young people to start understanding that, see, you're going to have a lot of challenges out there. Half the time you're going to, first of all, and when we see medical research, many people think it's by theoretical, or that you are mixing things together and coming up with, working in animals or humans. I hope you know that even the policy we talked about is the function of research. So all of these things will eventually come around together. So what I, as an academic, will do is I usually try to prepare students by making them first understand the real issues that are out there. So one of the things they are going to definitely face out there is one of the things Madam already mentioned, which is everything in Nigeria is out of pocket. This thing that one of our guys used to say, he says that every Nigerian is one step away from poverty. We just do not know yet. All you need is one chronic illness. So if any of us who think are billionaires today suddenly start treating cancers,
we'll know how we'll become poor. So most of the things are out of pocket. A doctor has to be cognizant of that fact. They have to be trained to understand that these people will not be able to afford half the things that you're about to put in on the plate. Which means that while we are training them, we should be training them for improvised solutions to some of these things. I mean, you're going to tell somebody to go and buy a drug right now that costs $57,000 we have once in UC this many times. And this person came in, he came in for benign prostatic hyperplasia. And then while we were doing all the normal tests, PSA, histology, and all of this, we found out that he actually has stage 1 CAP, that's prostate cancer. If that prostate cancer is total, the prognosis is 100%, it can be treated. But then, the drugs that we used to treat him gone. So when the man eventually did for a while, you know, options, by the time we offered options, and then